Making the transition to an emergency department can be challenging, even for experienced registered nurses. Our reporter Diane Easterbrook looks at how Providence St Joseph Health prepares new registered nurses and nurses transitioning practice to successfully and safely navigate this demanding specialty.
Making the transition to an emergency department can be challenging, even for experienced registered nurses like Leanna McCurchin.
You have to think quick because you never know what's coming in that door. So it can be a common cold or it can be someone in cardiac arrest. So you need to feel competent and confident to actually work on that patient.
McCurchin practices at Providence St Joseph Medical Center in Burbank, California, one of Providence St Joseph Health's 50 hospitals, where she recently transitioned from cardiac telemetry to the emergency department. The nonprofit healthcare system has a vision of knowing, caring, and easing the way for patients, which also extends to its nearly 120,000 caregivers in 7 states. That's why 3 years ago, Providence St Joseph Health rolled out an innovative clinical academy, a 12-month training program for registered nurses. The program is designed to help new nurse graduates, called residents, transition to hospitals, and experienced RNs, called fellows, change practice settings.
This is 36-year-old Michelle Golden. She was painting the roof of her house, standing on a ladder. The ladder fell backwards. She fell 14 feet down to the lawn below. She has some scrapes on her face and her extremities. She has some abdominal pain. Her leg was sprawled over the ladder, so she has some left femur deformity and a lot of pain there.
The program utilizes a flipped classroom model of teaching, which includes a variety of simulations using interactive mannequins to replicate what nurses might encounter in a hospital emergency department.
Hi, Michelle. I'm Amanda. We're going to get you checked in right now. What's bothering you the most?
My left leg is killing me.
Okay. Can you wiggle your toes and can you feel Tony touching your foot?
I can wiggle my toes, and my nose they're kind of numb.
Leanne Ogilvie is the director of Providence St Joseph Health's Clinical Academy. She says the program has 2 goals: support nurses transitioning to new practice and build a stable nursing workforce.
We find that nurses leave nursing in their first year because they are overwhelmed, they're not supported. They feel isolated after they come off of orientation specifically. Training a new nurse can cost you anywhere from $40,000 to $75,000 depending on the specialty that they're in. And looking at that turnover, we found that there was an opportunity to look at how we bring nurses on and to support them for that first full year.
Over the past 3 years, Providence St Joseph Health's Clinical Academy has helped and supported 600 registered nurses as they transition their practices to the emergency room. The Academy prepares them for almost every situation they might encounter in an emergency room, from cardiac arrest to trauma. Preceptors, experienced ED nurses like Tony Avila, partner with residents and fellows to ensure they have a dedicated support structure during their transition in practice.
You kind of have to just tell them, everybody goes through this. This is why you're in this program. This is why we're in this, partnership, in order to help you grow and help you become more confident in yourself and know that you can do this job.
Michelle, is your pain to the left hip?
McCurchin says the support and training in the Clinical Academy program has given her more confidence in the ED and recently helped her deal with an aggressive patient.
I can already see that he was escalating because he was tightening up his fists and he was pushing things to the side, and you can already tell that he's going to start, maybe start hurting or fighting with the staff. So what I had to do was call the code. It can either be code gray or code silver, and get other people involved so we can be safe and the patient too.
Ogilvie says before Providence St Joseph Health started the Clinical Academy, first-year turnover among new nurses was 25 to 26% annually. That's about average for most hospitals. But since the program's implementation, turnover has fallen by more than half.
Through that work, we've been able to take our turnover for first-year nursing from that 26% down to, it varies between 9 and 10%, but we've sustained that for 3 years. And so nurses who come through the Providence St. Joseph Health Clinical Academy are turning over significantly less, saving us millions of dollars.
Ogilvy believes that by increasing retention and stabilizing the nursing workforce through the clinical academy, they are improving the quality of care Providence St. Joseph Health provides to patients. I'm Diane Estabrook at Providence St. Joseph Medical Center in Burbank, California.